Due to COVID-19, New York State faces huge funding shortages. Without federal relief or new revenue, lawmakers may cut some state funding streams by 20%. This includes behavioral health care. Families Together in New York State set out to talk to parents and youth to share their experience and show how crucial their behavioral health has become. These are their voices.
My name is Christina. I live out on Long Island in Suffolk County. I have a 13-year-old son who is diagnosed with emotional disturbances, and he is in our mental health system currently. COVID-19 has affected my child significantly. Just being home, when you have a socially withdrawn child as it is, not having any public outcry to be able to go out or to go to school when that's the only time the child leaves the house was hard. Basically, for those first few months, my son did not leave the house at all. Ultimately, his social withdrawal did lead him back into the hospital. He wound up spending 4.5 weeks back in a psychiatric placement because he was unable to handle the pressure and the withdrawal of being isolated at home. I've watched friends test positive for COVID-19. I've actually lost one of my clients, a child that I work closely with. She was actually the first child here on Long Island to die of COVID-19. So that impacted us very hard here in the community. We've actually been having a struggle. We've been having a lot of difficulty since August of 2019 during the new redesign of the Medicaid waiver. When my son was released from residential facility, he's actually still currently waiting for some services. So prior to COVID-19, he was waiting on services that he should have had. We're still waiting currently. There is definitely a lack of resources in funding for the services our children do deserve and should have. I have a feeling we will not be able to serve our families anymore as it is, but everybody will be affected. Those children will be affected more. The services that we provide, the way that we provide them will be affected. The respite services, many agencies had to de-designate from respite because respite is one of the funded services. I, as a parent, am very worried. My son just spent 4.5 weeks in the hospital during this COVID period. I now wonder if I have to leave New York State, actually. I know it's going on elsewhere too, but New York State seems to be getting the brunt of it. Without his resources and access to the services he's had over the last year, while he should have access to them, and because he hasn't had them, he's been back to the hospital 5 times. Each time he was at the hospital, they made it clear that the reason he was there was because he didn't have his services in place. You know, you're talking about taking another 20% away, but where's that 20% coming from if we don't have 20% now to access the care that the kids need? So to know that this system is going to break even more than it's already broken is hard to hear right now for me. You know, like I said, a failed system, a broken system to begin with is going to be completely shattered, broken with a 20% cut.